All right, I'm going to be demonstrating second hip mobilization to decrease hip pain and also decrease pain caused by knee osteoarthritis. I have my patient lying supine, and I'm actually straddling her non-affected leg. And the leg that is affected, I actually have her crossed over, and so she is in slight internal rotation. And as I'm assessing her, I can actually find where the major restrictions are in her hip. And by causing her to have a greater increase in hip flexion, I can actually cause her to go into more external rotation, more internal rotation, and then also decrease hip flexion by lowering that leg. Well, we found most of her restrictions being up a little higher in her hip, so I'm actually stabilizing her here at the knee and like I said, straddling this leg. I'm actually creating a V with my hands and wrapping them around her femur, and then following that line of force right into that posterior capsule of the hip, creating an anterior posterior glide. I'm going to be doing a grade 4. And so what I want to do is find where that restriction is by pressing into the hip and finding that end range, and then doing a nice deep and fast oscillation into that hip joint. I would do this 3 times, 30 seconds each. And you can tell a therapist who have to do this a lot can get tired out pretty fast, especially with a larger patient who may have major restrictions and you have to mobilize that hip a little deeper. So you want to take a little bit of a break for your patient and for yourself. And then, as I said in the earlier video, there are 5 clinical prediction rules. And if you have at least one of those clinical predictor rules, you'll be 92% successful by combining these mobilizations together. And if you have 2 of them, you'll be 97% successful. So those clinical predictor rules are hip and groin pain or paresthesia, anterior hip pain, down off of here, passive range of motion, restriction in hip flexion in less than 122 degrees, also hip internal rotation less than 17 degrees, and then also pain in hip distraction. So combining this AP glide with that caudal glide, and then in the next video I'll be showing you the army crawl, which is the patient is in prone. If they have any of those 5 clinical predictor rules and you combine those, you can have a 97% success rate in decreasing pain. Like I said earlier, it is a decrease in pain, but it is only temporary. And so you would reassess this at about 48 hours after you do the mobilization to see if the patient has had a positive response for these mobilizations in decreasing their knee pain for osteoarthritis.